I'm putting recording on. Welcome, everyone. I'm really glad that you have been able to attend this short course on approaches for dialogue, deliberation, and decision-making in genomic research. I'm Ruth Ottman, and I am Deputy Director of the center that is co-sponsoring this course along with the Irving Institute at Columbia. And I'm just going to give a brief introduction and then we can get started. So I have some PowerPoint slides and I will, oops, I can't do that until I share my screen, can I? Okay. There, now I assume you can see that, right?
Yes.
Okay, so this is just the title of the course. And as I said, it's being co-sponsored by our center, which is the center, has a very long name. Center for Research on Ethical, Legal, and Social Implications of Psychiatric, Neurologic, and Behavioral Genetics.
Blue and gold, you know what I mean?
And
Super Bowl, big bro.
everyone should mute your sound, please.
All right, for sure.
Our center is a center of excellence in ELSI research, funded by the National Human Genome Research Institute. And ELSI is an acronym within the acronym SEER that stands for Ethical, Legal, and Social Implications of Genetic and Genomic Research. And the goal of the SEERs, there are several SEERs located throughout the country. And their goal is to bring investigators from multiple disciplines together to address important, thorny, and new problems related to genomic research, that ethical, legal, and social issues related to advances in genomics. Our SEER has been in existence for 12 years. It began in 2010, and it's the only one of the various SEERs that are funded throughout the country to specifically focus on psychiatric, neurologic, and behavioral genetics. Our director is Paul Applebaum. He's the Dollard Professor of Psychiatry, Medicine, and Law, and Director of the Division of Law, Ethics, and Psychiatry at Columbia. And we also have a strong collaboration with the Hastings Center, a bioethics research group in Garrison, New York. We have a number of different activities that are involved in the SEER. We conduct research. We have a yearly conference. We have monthly seminars. We have a website, and you can see the URL of the website in the footer of my slides here. We have a monthly electronic newspaper, sort of, that is a compendium. It's called Brain Gen Ethics Update, and it's a compendium of recent research on ELSI and also on the science related to psychiatric, neurologic, and behavioral genetics. And it's very, very useful, and I highly recommend it. And you can subscribe to that and also get announcements of our monthly seminars by writing an email to Dr. Applebaum, and here is his email address. We also conduct training and short courses like the one that we're talking about today. And this is the 7th short course that we've had. And their goal is to encourage and promote ELSI research by providing education and training about topics and methods that are important in this arena. So for the current short course for today, we had a planning committee consisting of myself, Dr. Abby Fire, Dr. Elizabeth Cohn, Dr. Maya Sabatello, and Ms. Josephine Johnston, all of whom are members of our steering committee for the SEER. And we thought it was especially important to focus the short course on this area because genomics research and practice, perhaps even more than most other areas of research, have complex ethical, legal, and social issues for multiple stakeholders. And what I mean by stakeholders is people and groups for whom both the methods and the results of the research, genomic research, really have meaning and impact. So some examples would be obviously researchers, clinicians, people living with or at risk for genetic disorders, family members, clergy, marginalized communities, and the public. And these different groups, and of course, diversity within the groups as well, have beliefs and opinions and values that may vary, both within and across groups. And so these different perspectives really raise challenges for developing policy and practice recommendations in this arena. And so there have been a variety of innovative research methods that are developed to gather data on the views and values of members of these diverse groups, encourage dialogue, and elucidate areas of agreement and disagreement. Not necessarily with the goal of reaching a consensus, but simply bringing to light the areas of agreement and disagreement and the different perspectives. So our speakers today are going to describe several different approaches that have been developed to accomplish that. And this is an outline of our schedule for the day. We will have each speaker give a 30-minute talk, and then there'll be 10 minutes allocated to questions or discussion afterwards. And we'll have a break, a 10-minute break after the second presentation. I'm going to do a brief introduction of each speaker when it comes time for them, but also you can learn more about them in the copy of my slides that I've put a link to in the chat. So you can see that there's a little more detail in there. Before we begin, I just want to say that right after the session today, you will be receiving an email with a link to an evaluation form. Please complete the form. It'll be very helpful for us in planning future courses like this one. Okay. So with that, I'm going to stop sharing because you can see this detail later. If I can figure out how to stop sharing here without, I have to out of this, here, stop sharing. Okay. So our first pair of speakers are going to give a joint presentation, and they are Drs. Jessica Burke and Sarah Bauman, both of whom come to us from the University of Pittsburgh School of Public Health. Dr. Burke is professor and vice chair for education, behavioral, and community health sciences. And her research addresses social and environmental health determinants, but using community engaged and creative methods, particularly those that involve visual elements. And her co-presenter is Dr. Sarah Bauman. She is assistant professor of behavioral and community health sciences. And she's a global health researcher interested in participatory and creative visual research methods, also in women's reproductive health and mental health. And they're going to be speaking to us about concept mapping. Thank you.
All right. I apologize. My internet connection's a little unstable. So if there are any issues, please make a note in the chat so my co-speaker, Jessie, can jump in. So very excited to be here with you all today. Thank you so much for having us. My name is Sarah Bauman. I am an assistant professor at the University of Pittsburgh, and I'm going to be co-presenting with Dr. Jessica Burke, who is a professor and the director of the Concept Mapping Institute here at Pitt Public Health. So the title of our talk today is Concept Mapping to Elicit Perspectives of Diverse Stakeholders on Genomics Research and Practice. So the objectives of our talk today is to basically describe how concept mapping can be used as a stakeholder engaged participatory method to address genomics research and practice in these areas of ELSI that Ruth just talked about. We want to also explain how the method can be used to elucidate areas of agreement and disagreement. But first of all, you may be wondering, what is concept mapping? So concept mapping is a structured process focused on a topic or construct of interest that involves input from one or more participants that produces this interpretable pictorial view, basically a concept map of ideas and concepts and how those are interrelated. So you can see an example of that here in the bottom right-hand side of the slide. And it is a multi-step method that explores the relationships of ideas and concepts and allows us to also develop group consensus about a particular topic. There are 6 general steps in concept mapping, which I will walk through just briefly here today. So the first step is preparation. And in the preparation stage, this basically involves outlining the research goals and determining the participants that you're going to use in the recruitment process. The next step is generation, in which we generate and brainstorm ideas in response to a focal question. The third step is structuring that data. So we sort and rate those items. Then representation is basically running a multi-level analysis to create these concept maps that you saw on the last slide. Step 5 is interpreting that data. So working in group discussions to understand the meaning of that data. And then finally, there's really this focus on utilization and concept mapping. So how can these findings be used to inform research goals, especially when it comes to policy and intervention related implications? So in concept mapping, there are 3 particular sessions that we hold with participants. So in these sessions is really where we're connecting with participants and discussing data with them. So in the first session, this is called a brainstorming session, in which we're generating and collecting items in response to a particular focal prompt. So that focal prompt is related to the research question. In the second session of concept mapping, we're sorting and rating that data. So this is involving structuring and organizing those items, sorting and rating them into particular clusters and groups. So during sorting, the items are grouped together based on perceived similarities. And then in rating, each item is basically rated on a predefined scale that's of interest to you as the researcher. Then in the third session, this is called the interpretation session. And this is where we share the results from this multidimensional scaling. We're basically sharing the concept maps that have been created in the previous 2 steps. And we're holding a discussion to really discuss the key components and action steps based on those maps. And thinking about concept mapping participant samples, it's important to note that the identification of participants is really going to depend on your research goals. And we're going to walk through an illustrative example of that in a few minutes. It's also important to note that this is primarily a qualitative research method, so the goal is not to create generalizable findings. And the general guidance for concept mapping is to hold these sessions with more than 25 participants to really make sure that we're maximizing the consistency of fit in the concept mapping representation that's run in the scaling and modeling. When thinking about data collection for concept mapping, it can happen both online, in person, or using a hybrid approach. So as you see on the left-hand side of the slides, this is just an example of an online session that we've done with concept mapping. So your participants will be seeing a focal prompt. They'll have spaces to enter those ideas that they have, and then they will sort and group those together. And that can happen fully online. From the images on the right, you can see that you can also hold these sessions in person, in which you literally print out all of the ideas that they shared, they group them and sort them in really a physical way. So this process of concept mapping is participatory in a number of different ways, but this is really interesting, I think, to look at this spectrum of community participation and community engagement. So when you're thinking about concept mapping, you may be able to use this in a way that's a consultation way with your participants. So thinking about maybe consulting your community stakeholders to do a community needs assessment. But we can also think about using concept mapping in a more a deeper involved way, where we have participants actually really partnering with the research team. And an example of that is with this new measures or theoretical frameworks, as you see in the center of the slide. And Dr. Burke and I have actually used this approach where we've involved participants in developing a new measure. We've done this in Nepal with a group of adolescent girls to develop a measure for empowerment. So really partnering with them, pulling their ideas together and using concept mapping to sort and rate these items and cluster them to develop the most ideal new measure for measuring empowerment. But you can imagine you can go even further, where you can develop research agendas, you truly collaborate with your participants, and even go as far as shared leadership, where you might use concept mapping in direct practice and community action. So really there's a range of opportunities to apply concept mapping in partnership with your stakeholders, community members, or participants. And I think I'm going to pass it to Dr. Burke to talk to us just a little bit about some examples of that.
Thanks, Sarah, for the introduction. We've been using concept mapping for a number of years, and we were trying to figure out what's the best way to present it to a group to consider the range of opportunities that exist in terms of how you can use concept mapping for your own work. And I'm just going to provide a couple of examples here. So the first is about how it can be used in consultation with stakeholders. And in this case, we used it in community health needs assessment work that we've been doing at the UPMC hospital system here in Pennsylvania to develop a better understanding of perceived health problems within hospital communities. And so this is a very broad question, but essentially in the brainstorming sessions where we worked with the hospital community advisory councils for multiple hospitals, we asked them, what are our community's biggest health problems? So there was a focal prompt. They generate responses. In this case, there were over 50 responses. And then they're asked to sort and rate those items. And so in the sorting process, essentially the three clusters that you see there of prevention and healthy living, chronic diseases, and navigating the healthcare system were identified. So the 50 items organized into 3 concepts. And then the rating allowed us to look at the significant health needs that are critical, addressable, and have a high level of urgency in each hospital. And so we present this example as one that really shows us how concept mapping can be used to integrate stakeholder input. And unlike other traditional needs assessment methods, this really helps for stakeholder input into the identification of needs and goals. And it's through this consultation that you can get increased attention and community ownership. So that's one example. The next example here is work that we did as part of the Clinical and Translational Science Award projects in 5 different settings. So in North Carolina, Arkansas, Florida, and UCLA, as well as Pittsburgh. And this project was completely different. So this is showing us that concept mapping can be used to address a different focal area. In this case, what we wanted to do was to understand more about the factors that are necessary for creating and maintaining trust within research partnerships. And so working with, in this case, 3 different stakeholder groups, so community members, healthcare providers, and academic researchers, we used concept mapping to ask first, based on your experience, list all the things that you think contribute to trust between community and academic partners in research. They generated 125 items, and through the sorting process, we identified 5 clusters of items, and you can see them listed here. We also asked a number of rating questions: importance for creating trust, importance for maintaining, and how important is it for public trust in general. And again, this demonstrates how concept mapping can really add and build in terms of the development of a new measure. In this case, we provided these items for use in the future measure addressing community trust. The third example moves into more practice-oriented. So it's an example of cultivating a community academic partnership. In this case, we were working with a battered women's shelter, the House of Ruth, and we included a number of stakeholders in the concept mapping project where we worked with local service providers, academics with experience addressing domestic violence, and we asked, what do we need to know in order to improve services for battered women and their children in the region where the House of Ruth is located? And again, this was developed in collaboration with staff from the House of Ruth. And really, we wanted to identify what are those areas where we need to focus our attention, and then how feasible is it to address them, and how important. And in this case, we asked that in terms of how imperative is it that we address the issues. And in this case, the brainstorming resulted in 66 items and a 9-cluster solution. And participants identified a range of issues that were particularly important for programmatic services and for future research. So again, we're moving into, this could help us through collaborating to come up with goals that are grounded truly in the community needs. And the final example is from a collaborative called the Allegheny County Breast Collaborative, which includes clinicians, academic researchers, staff from other nonprofits, community members. And this has been established, I think we're going on 10 years now. And as part of it, we've used concept mapping with community members to ask the question, what are the things, either good or bad, that affect breast health for people in this community? And again, you can see a range of responses and the number of clusters, and then how we had them rate those items in terms of how important is it, how does it in fact impact the chances of a person in the community getting a mammogram, et cetera. Now, I know these examples are all sort of overwhelming, but the point here is that concept mapping can help you to dial down and dial back up, right? So to ask about the universe of responses to a question and then help you sort those and organize those findings. And so all of these, you can see that, we asked a focal question, generated a number of responses that were the universe of what those participants could come up with. And then instead of having to focus on, for example, in the last case, all 75 items, we can group them into 7 areas and talk about them that way. And what's really critical here is that those are the participant groupings. Those are not me as an academic researcher saying, okay, I think these all go together. In fact, this is through, developing the consensus about where those items go. And so that's what we wanted to focus on a little bit more. Next slide, please, Sarah. So this is the visual nature of concept mapping is something that I absolutely love. I'm a visual learner. I need to see it. And so when you talk about items being related to each other, it's very different when you can see them presented in context and case. And we'll go through this in detail in a minute, but essentially all of the points that are on this map on the left-hand side are items that were generated in the brainstorming sessions. And then it is the relationship or the distance between the items that illustrates perceived similarities or differences. And we'll walk through an example in a minute. And then on the right-hand side, after applying cluster analysis, it groups those items into distinct clusters. So this example shows us 125 items, and then through the results from the participant sorting data, we see that they group into 8 clusters or concepts. And it's this visual process which really helps when you're working in collaboration with other stakeholders to talk it through and share what the results are. Next slide. All right, so the other piece is that in a relatively short time frame, I think it's all relative because a lot of this work, it's iterative, there are multiple sessions, but in a relatively short time frame, you can really explore complex ideas. And this example is drawn from some of our original work where we were looking at neighborhood context and health, which was at the time fairly abstract. We didn't know much about how the factors at the neighborhood level were related with health outcomes. In this case, we were looking at intimate partner violence. And what we did was work with participants and say, what are the range of factors, good or bad, that are related to experiences of intimate partner violence? They generated a list of 51 items, sorted those items, rated those items, and then in the interpretation sessions, explained to us how they all relate to each other. And so on the left-hand side, you can see the items within a cluster that they called community enrichment resources. In the middle is the text from the transcript of the interpretation session where they explain how the items are related to each other and why they're all there. And then on the right-hand side is a figure. They drew it out and then we, recreated it in PowerPoint, but essentially talking about how home ownership is the main thing. And then when people own their homes, they take a stand, they're alert, they'll call 911. And how important that is for reducing intimate partner violence. But also if you have areas with low home ownership and job availability and not a good job, that's going to cause stress, which will contribute to violence. Now, this example obviously is not directly applicable to what we're talking about today in terms of your topic, but I think it shows you how a complex topic can be really explored in great detail using concept mapping. All right, next slide, and I think I turn it over to Sarah. Yes, so we're going to talk through, I'm just going to set this up for a second, that we're going to talk through an example of each of the 6 steps for concept mapping and try and present an illustrative example that will help ground it in the field of genomics research. And it's a basic example, but it's one I think that should highlight and help with this interpretation of how can we take what we're sharing and then translate it to this particular field. So Sarah.
Thank you. So yeah, we'll go into a little bit more depth into each one of these steps now to kind of illustrate what is all involved in each of these steps. So as I mentioned at the beginning, you probably remember those 6 steps at the beginning of the presentation. So the first one is preparation. And so this is really the foundation of setting up your concept mapping project. And here is where you're going to outline your research goals, develop this focal prompt that you're going to want your participants to respond to, develop your rating scales and some demographic questions. And as Dr. Burke mentioned, I'll walk through an example here to show you what that may look like in genomics research. You're also going to want to think about and determine the participants. So how are you going to recruit them? Are you going to do this online, or is it better to do it in person? It really depends on your research question and context. And then of course, getting IRB approval for your research protocols and your consent forms and reimbursements. And so that's obviously a step we'll want to take at this stage too. So coming to the example on the right side of the slide, you can see this is our genomics research and practice illustrative example. And so we developed this example in partnership with our human genetics department here at Pitt Public Health. Dr. Burke and I are not genomics researchers, but we are fortunate to have a department that was able to support us with developing this example. So I'm hoping that this is relevant in some way to your work. So in our illustrative example, our goal was to develop a stakeholder-informed intervention to reduce genetic counseling appointment no-shows. And so that's kind of our broad overarching research question. And so from that, we developed a specific prompt that we are going to pose to our participants. And so that prompt is, what information is essential for people to know before scheduling a genetic counseling appointment? So very specific, something people can get their head around and answer relatively quickly. We also developed 2 rating scales, so really to help us round out this information, more information that we want to know, in addition to those, 100 prompts that people will probably develop based on the, 100 items they'll develop based on the prompt. We're also going to want to know how important is each of these items, which items are more important and which are less important. And then we also thought it would be interesting to look at feasibility to address in a healthcare setting. We also will develop demographic questions. So in this example, we might think about things like stakeholder type or educational background of each of our participants. And then for the participants, who do we want to ask to answer this question? So we thought it would be important to ask genetic counselors, researchers, clinicians, perhaps people living with or at risk for genetic disorders, and their family members. So that's all of the kind of steps that we do for preparation for the concept mapping project. So step 2 is the generation process. So this is where we're actually going to start developing lists of items, so really generating data in response to that focal prompt. And so in this step, we'll prepare a list to use in the subsequent steps as well. So you can imagine that we might generate 100 items, our participants might generate 100 items. You can imagine there's probably going to be some duplication here. So in this step, we also will remove duplicates and potentially group items that are similar into one statement. So 200 items might become 150, something like that. So coming to our illustrative example here, as you remember, our prompt was what information is essential for people to know before scheduling a genetic counseling appointment. And we actually posed this question to a number of counselors, faculty, and students in the human genetics department at Pitt Public Health. And these are some of the responses that they generated. So things like family history, knowing the length of the appointment and whether or not your insurance was going to cover that, the cost of genetic testing, a suspected diagnosis, what to bring, what happens at the appointment, an explanation of genetic counseling, even a reason for the appointment, where is the clinic office location, and what is a genetic counselor's job? These are all just examples of things that people shared in response to our focal prompt. So that's great. We generate all of these amazing data points, all of these items. What do we do with all of it? The next step is coming to this sorting and rating. So this step 3 actually has 2 parts. The first part is sorting similar items and grouping similar items together. And then the second part is prioritizing items. So let's walk through the illustrative example here. When we ask participants to sort the items, essentially we give them a list of all of those items that we generated in the previous step with the duplicates removed. And we tell them to categorize the items into piles that make sense to you and provide a name for each pile. So you can see after this, things are starting to come together in terms of structure, and you're starting to see things cluster together. So it's really important that we give them this space to really cluster the items in whatever way that makes sense to them. The next step in this process is to use the rating scale. So what we'll essentially do is the same items that were used for that sorting activity will be given to the participants. And for each item, they will be asked to rate the items based on those predefined scales. So we had talked about importance. So for each item, they will rate it as between 1 and 5. Is it important, extremely important, or not important at all? Similarly, with feasibility, they'll go through each item and rate that item in terms of feasibility, whether or not it's not at all feasible to even address something like this in a healthcare setting, or it is really extremely feasible to address this in a healthcare setting. I'm gonna pass to Jesse.
Yep. So now we have the items data, we have the sorting data, we have the rating data. What do we do with it? And this is where what has been primarily qualitative now sort of morphs into a little bit more of a mixed method and so there are 3 steps involved in analyzing the sorting data. You create a similarity matrix, you use multidimensional scaling, and then you use cluster analysis. We're going to walk through each of those so that you can understand what's happening at this point. Next slide, please. All right, so the sorting data. So just to make sure everybody's following along, let's say that we generated a list of 10 items in this case, and we have everybody who's participating sort those items into piles that make sense to them, and then they apply a name, they write a name or a reason why they've put those items together. And what we do now is take the sorting data for each participant and organize it into a matrix where you have as many rows as columns as there are items or statements. And I should be clear that we're not doing this by hand. There are a number of software tools out there. In our case, we like to use one called Group Wisdom, and we could provide more information about that if you're interested. But you're taking the sorting data and you're making sure that you're looking at the matrix for each of the participants, and then essentially you're layering those on top of each other. So you're taking, if Alexis did one, Jesse did one, and Sarah did one, and we're counting up where we sorted the same items together. And that's where you're going to count up in the bottom there. You see, if you look across 5 participants and how they organize those 10 statements, you can see that, for example, item number 4 was organized or was sorted with item number 1 by 4 participants. So this is just taking data and organizing it into a similarity matrix. Next slide, please. All right, so what concept mapping does is then take that similarity matrix and use multidimensional scaling analysis to represent the perceived similarities between items as points on a 2-dimensional map. So that's what we see here. This map is presenting, the points are statements, and the numbers just are the assignment of a particular statement. And then the focus of the map is on the relationship between ideas. So as I mentioned earlier, the distance between the items is what matters. On this map, you can see that statements that are organized in close proximity to each other were perceived to be quite similar by a majority of the participants. And if they're further apart, that means that they were not seen to be similar. So Sarah, I think if you can click through, there's an item number 24. For example, that could be the length of the appointment that we talked about earlier. And then it's further apart from item 71, which is what is the genetic counselor's job. So this point map is taking the similarity matrix and it's positioning it onto a 2-dimensional map. And what we can use here is a diagnostic statistic called the stress index, which essentially tells us if the visual representation is a good approximation of the actual matrix, and the lower the score, the better, so that we can feel confident that what we're seeing here is representing that layered matrix that we talked about earlier. Next slide. All right, so now we have all of our items on a point map. So we can say by looking at them how similar they are to each other. Again, items that are further apart were perceived to be more different by a majority of the group. And we can apply hierarchical cluster analysis. And it essentially is grouping statements on the point map into clusters that aggregate to reflect similar concepts. And it's using the XY coordinate values from the multidimensional scaling here. And I'm not going to get into great detail. We could go on forever, but we only have a few minutes. I just want to show here that essentially what you're doing is looking at how many clusters are appropriate for that universe of items that were generated. And you can do that by going up and down in terms of looking at the number of potential clusters. So what we have here is 7. We could look at a 6-item cluster, 6-cluster map, and you would see where it would consolidate. So for example, I believe on this map, clusters 5 and 6 consolidate, and you can see that they're related to each other. And the question we often get is, well, how do you decide what the actual final cluster solution is? And that's where concept mapping is really a participatory or engaged approach. And so it's through the discussions with participants that you can come up with that final solution. And you can look at how many piles were generated from each participant in the sorting process. All right, on to the next. Oh, so sorry, that was, I forgot I had an example here. So for example, cluster 4 includes the items length of appointment and what happens at the appointment. And cluster 7 includes explanation of genetic counseling and what's a genetic counselor's job. And so looking at those results, we might want to call cluster 4, appointment logistics, and cluster 7, the role of the genetic counselor. But really, we want to do that in collaboration with the participants. Next slide.
And just to let you know that, we're at 30 minutes now. So I want to make sure we do have enough time for people to make comments.
Yes, thank you. We are almost done, so we should be fine. All right, so the pattern matching, we have, you can look at comparing the ratings and explore how they're related to each other. So you can look at importance versus feasibility. But back to a point that we raised earlier, you can also compare based on differences in the demographics of your participants. So it might be very important in this case to explore differences between clinicians and patients, or researchers and practitioners. And you can see which they rate as more important and more feasible, and that will really help you to gain some insights. Next slide. So for cluster 4, I just pulled one out. Another option is this go zone. So now we're back at the items, looking at the items within a cluster, and it'll tell you which are most feasible and most important. That number 24 appears, so the length of the appointment in terms of what we might focus on for an intervention. Next slide. And then interpretation. This is the critical step. So we've asked about the universe, we've asked them to organize them, we've asked them to rate them, but now we want to understand how everything is related to each other. And that's what that third session, we have participants come back together and talk through the results. And usually we do that in a small group where they look through the items, they assign names, they discuss the relationship. Remember the figure that I showed you earlier. And really, if we were, for the purpose of the illustrative example, we would ask them to develop an intervention design to address those items, and what do they think would work. And so then that information is available in terms of the next step, which is step 6. And what does it all mean? So we've spent a lot of time here with participants, asking them a lot of questions. What does it mean moving forward? And in this case, it means that you really would have a stakeholder informed intervention to reduce genetic counseling appointment no-shows. And what you could do is take all that detail in terms of which items are within which clusters and develop intervention components to address those, and then evaluate that information. Next slide. So I think we've talked about this. For the sake of time, I'll just move along, but concept mapping is very flexible and it can be utilized in a number of ways. Next slide. So we as good academics, always are looking at what's being published and how people are using concept mapping. And I put this here to just show you that it's been used to address a range of health issues and in community engaged ways. Next slide. All right, so I think I'm going to turn it back over to Sarah. She will wrap it up and we will have hopefully about 5 minutes for questions.
Thanks, Jessie. So just to wrap up kind of the key benefits of using concept mapping, we wanted to point out here that the participatory nature allows us to collaborate and validate our findings. It also provides an opportunity to generate this in-depth understanding of a topic of interest, but also the relationship between those data points. What are the relationship between the constructs of a particular topic that you're interested in? It's also beneficial for developing group consensus. So you're asking a lot of people to provide input. And so it can help us to identify areas of agreement and disagreement across diverse stakeholder groups. It's a structured process that you can get a lot of data, as you can see, in a relatively short period of time. And it involves participants engaging in the process both individually and as a group. But as you can imagine, there are certainly challenges with the method. It can be resource intensive. It can be a lot to ask participants to engage in this process, as you can imagine. And there's also this temptation to assign inappropriate value or weight across these rating scores. So just keeping in mind that it is primarily a qualitative method and a participatory method. So just making sure that we're interpreting the results appropriately. So overall, we are excited to present concept mapping because we truly do believe that it's a useful method for exploring and understanding complex phenomena, exploring similarities and differences, and developing group consensus. And so, as we talked about, it applies this quantitative approach to qualitative data, and you really get these powerful visual representations of the relationships between ideas related to your topic. And so it can help multiple stakeholders find common ground and help you to develop really practical, pragmatic solutions to your topic. And we hope that this will be helpful in the ethical, legal, and social issues related to genomics research. So we will end there and open it up for some questions. Thank you very much.
Thank you. That was fabulous. Absolutely fabulous. I learned so much. We have time for questions. We have 3 to 5 minutes, I would say. If you want to ask a question, you can put it in the chat, or you can turn your video on and turn your voice on and just ask. Sarah and Jesse, do you want to stop sharing so we can see all the faces? That's great. Questions or comments?
Thank you.
Seeing a
It's
hand raised.
Great presentation, and actually a great question of how to reduce the no-show in genetic counseling. I have a question. Do you predefine for the participants how many groups they should be sorting the items into, or are you giving completely to their own will?
Yeah, that's a great question. So it was very hard to cram in all of the details in a very short amount of time. So I'm always happy to talk about more specifics, but essentially the sorting exercise, the guidance that's provided is place them into piles that make sense to you. And, you know, because everybody perceives things differently, but don't put them all in their own pile and don't put them all in one pile. But beyond that, it's up to them how they want to organize them. And then they are asked to include a justification for why they put the piles or the items into that pile. So, you know, some people may place them into 3 piles and others may do 6. And that's fine as long as they give an explanation of why.
Other questions or comments? Josie?
I was just wondering about how much time it's good to allow, like between the meetings, but also for the sort of whole project. I know it depends, but do you have sort of a sense around that? Like how, if it's too, you know, what's a good amount of time for people to reflect between meetings, and what would be too long? Or
Yeah, so that's also a great question. It does depend, but on average, you know, having a couple of weeks between the sessions is helpful for the researchers to compile and sort of organize and analyze and be familiar with the data, so that then when you come back, say for the sorting and rating, you feel confident that you have a good list of items to be included. And then the same is true when you go from the second session to the third session, that you want to have done some exploration of the data before you get there and are trying to walk through it with your participants. In terms of the timing that it takes to do the sessions themselves, It varies. We mentioned in person or online. So you can do brainstorming online, in which case it's great that participants can do it on their own whenever they have time to go click on the link. I prefer, pre-COVID times, I prefer to do them in person. I think it's nice to establish those relationships and do it as part of essentially a round robin brainstorming session. And so when we count up the number of hours, it's essentially about 8 hours of time in group and sessions. Does that help? So it's fairly intensive and you need time in between, but you can do it quickly if you have to. I mean, we have done them in, weekend sessions, but you're spending the whole weekend sorting, rating, organizing, etc.
We have.
So I think that.
Go ahead.
Go ahead. I was just going to say, I think there was a question in the chat about, is it the same participants? Yes. So essentially, in an ideal world, it's the same participants who are doing the brainstorming, sorting, and then the rating and the interpretation. And they are brought back for separate sessions. So we do it now in 3 sessions. So brainstorming's 1 session, sorting and rating is the 2nd, and interpretation is the 3rd. But it is, real life, right? And sometimes people aren't available or they weren't available the first session, but they're interested in getting involved in the second. And that's where I think you have to be driven by what your objectives are and your goals. And if you're comfortable with adding in people and explaining how we got here, I certainly advocate for that, because I think you want more stakeholder buy-in and participation. So there is a flexibility there that exists.
Okay, we have 2 other questions that are in the chat. We're very short on time, but I really want to have people be able to ask their questions. So I'm going to go ahead and read them to you.
Okay.
How is concept mapping different from surveys via usual data software available out there? And also, are there any data mapping aids available commercially?
Yeah, so that I would love to, maybe we can have a conversation on the side about that, but essentially concept mapping is different because it's a series of steps to develop an understanding of concepts, and you could achieve those by doing surveys, but it's not then called concept mapping, right? You're asking questions, and then what's inherently good, or in my belief about concept mapping, is that it is so engaged and the participants are involved in all the steps. And then are there aids available commercially? So like I mentioned, we use a software program called Group Wisdom, but there are other options out there. Group Wisdom is really helpful because it's very user-friendly for the participant and for the researcher.
Okay. I think we're going to have to stop it there, but thank you so much. That was really fabulous.
I will answer it in the chat too. Thank you all so much.
Terrific.
All right. I look forward to seeing all the other presentations.
Okay. So our next speaker is Dr. Vanessa here at SUCA. And she comes to us from the University of Alaska Anchorage Center for Human Development, where she is assistant professor of clinical and translational research and co-director of research and evaluation. Her specialty is the ELSI of genomic research and practice among indigenous populations and cultural adaptation of chronic disease and behavioral health interventions. So thank you very much, Vanessa, for being with us.
Yeah, great to be here. And just to double check, is everybody seeing just the slide for the introduction slide for me?
Yes.
All right. Well, with that in mind, I'll go ahead and launch in. Again, just really a joy to be with you all this morning. Well, morning for me, afternoon for many of you on the East Coast, and for those that are in between the two of us, sometime around lunch, I'm guessing. With my talk today, I was hoping to get into some of the details of public deliberations that we've conducted, both here in Alaska. I'm based in Anchorage, our urban center of our state, and some of the work that I have been doing in public deliberation and deliberation in general has been through the Center for the Ethics of Indigenous Genomic Research. It's one of the CERs that Ruth had mentioned earlier. And I'll go ahead and launch on in here. So I wanted to give a quick background on the population that our deliberations have addressed. And many people don't know much about American Indian Alaska Native people, so I just wanted to provide a brief background. There are currently 574 federally recognized tribes in 37 states. We number over 5.2 million, and that was in January 2020. American Indian Alaska Native people have experienced, due to systematic inequities, lower health status when compared to other Americans. And I'll talk in a moment about some of those health issues. But I think it's important to remember that American Indian tribes are sovereign nations, and we have as tribal members and our tribes have inherent right to self-determination, including deciding on whether and how research may be conducted. And I bring that up because it matters in the types of deliberations and the questions that we were interested in. So just a quick brief on American Indian Alaska Native health. There is indeed a lower life expectancy, so there's a public health significance in working with this population. There are unfortunate number of disparities that you can read here on this slide, and many of our tribal leaders and public health leaders have been interested in, closing these gaps in disparities. And one of those ways to do that is through our genetic research and precision medicine research. There's a hoped for support for American Indian Alaska Native peoples, be it on reservation or off in our urban areas. With an enhancement and recognition of tribal sovereignty and self-determination of tribal peoples, we have had a bloom in the number of tribes that have assumed care, have assumed responsibility and management of healthcare services. And as healthcare services have been taken on by tribal governments and consortia of tribal governments, there has been a similar type of shift in research review, with that being managed by Alaska Native American Indian tribes. And interesting to the tribal leadership is to hear the community voice to enhance their decision-making related to healthcare. Many decisions are based off of local values, tribal values, norms of behaviors. And I just wanted to share some universal values that are common amongst Alaska Native peoples, of which there are 230 plus federally recognized tribes here in Alaska. And these values are what drive healthcare decision-making. And I think it's always important to bear in mind the values of an organization, of a people. One of the things I also wanted to talk about just briefly is how, yes, these are values of Alaska Native peoples, and each tribe has particular values to their tribal peoples. In our Seeger work and our SEER work, we had worked with 3 different tribal sites, an urban center here in Alaska at South Central Foundation, which was my former employer before I moved to the University of Alaska, Anchorage. Then we had also worked with the Chickasaw Nation in Oklahoma and Missouri Breaks Research which is based in South Dakota on the Cheyenne River Reservation. And I'll come back to those different tribal organizations and their values as we move into specifics around the deliberations. But first, I wanted to present a little bit of information about public deliberation. Goodness, it must have been about 5 or so years ago when my organization was approached by the developing SEER. We were talking about doing public deliberation, and as a mixed methods public health researcher, I was quite familiar with interviews. I was quite familiar with focus groups and a few other forms of engagement on the qualitative side, but I hadn't heard of public deliberation. And so what I'll be sharing with you in the next couple slides is a bit of the information that I had garnered and gathered from experts in public deliberation, both here in the US and overseas, to try to understand the why and the what of public deliberation. And I found it to be a rather difficult process. For myself, I'm a researcher that has come up through the ranks. I started as a program manager and evaluator, and then thought I really wanted to learn more about traditional research and community engaged research, and went back to school and did that while working full time as a research assistant, and then later as a PI. So with that in mind, I have a lot of interest in, and I'm just kind of a pragmatic soul. So I like to know how something gets done. Indeed, I'm a why person as well. Why do we do it? But I really do care about the how does it get done? How much does it cost? Who is the one doing it? And on and on. And being a tribal member myself, I am aware of many of the different issues that have come up between external to the community, healthcare workers and researchers, and mistrust. And so I am always looking for innovative practices that allow for the inclusion of community members at all points in the research process. And when our SEER PIs had brought up the idea of public deliberation, my little ears perked up, and I wanted to learn more. And so here on the slide, you've already read probably some of the basic whys of public deliberation. This is a process that includes individuals that are from the public. So these are people that don't have a specific understanding, necessarily a deep understanding of a particular process or question or topic. These are everyday people out on the street that are engaged in deep conversations where they are allowed to reflect and dialogue with one another to discuss different issues. Public deliberation is a form of engagement. Oftentimes it's used in political discussions for initiatives that might be proposed. And it's really built for describing and allowing individuals to discuss their values and to put forward their ideas in I'll let you go ahead and look at these different bullets, but oftentimes the public deliberations, they can look differently. I shouldn't say oftentimes, public deliberations look very different. And so they might be inclusive of small gatherings like a citizen jury. It might be a larger gathering of a citizen assembly. There may be during a deliberative activity polling and scenarios that are put forward, different types of instruments that are used to elicit conversation between these different members of the public. And they can last a day or less, or they can be extended to several events that are lasting several days and over a period of months. And this is a process that has, of course, as all forms of data collection do, various critiques. And some of these I've listed here, but there's a concern by deliberation scholars that public deliberation hadn't allowed for the minority voices to be engaged in the conversation and be fully present in consensus, if consensus was the goal of the deliberation. So in response to various critiques, there has been an evolution of the deliberative practice, and that is inclusive of using different forms of speech, allowing and facilitating such that people can share their self-interest, their emotions, that there's space for disagreement, and then also the use of enclave deliberation, where groups of people from the public are deliberately grouped together based on certain important characteristics to allow people to discuss amongst themselves before coming back into a larger group discussion. So I wanted to share a couple of frameworks for deliberation. And so the first is from Robert Dahl, where he highlights inclusion, opportunities for participation, and enlightened understanding. And here I have a few of the definitions of what he means by these different, what was meant, at least in one of his writings, by these different terms. By inclusion, it's a democratic process that is including essentially all adults, that there are opportunities within the event for people to vote and debate, discuss the question of interest, and that the processes that are used in the deliberation allow people to get information about a topic and to discuss these different alternatives. Then there's another framework for deliberation that I found to be interesting and that we had eventually really focused on and used in the planning of our public deliberations that I'll talk about. And that is from John, I do not know how to say his last name. I want to say Gastill. Maybe you all in the audience know him and could correct me, but he brings up two different things that I thought are very helpful. Well, one is that this is a thoughtful discussion and an analysis of the issue. It's guided by a moderator or a facilitator, and it includes analytic components, which are listed here, as well as social components. And so his framework gave me a little bit more of an understanding of what might be occurring, why you want to have different components in your event, your deliberation event, and a little bit more about how to get there. But I have to say, as we were in our different site leads, of which I was one of three, were discussing public deliberation, I still did not have a grounding as to what it would actually look like and if it was appropriate for our American Indian, Alaska Native communities that we were working with. A small group of us went ahead and were discussing that issue of appropriateness of this methodology. And a couple of our team members delved deeply into deliberative democracy and historical perspectives on decision making. We put forward a paper on this, and in this exploration that a few of us had done, we were looking at historic ways that different American Indian Alaska Native peoples have been in discussion with one another over issues of public concern, and trying to determine that fit between the ideals of deliberation and governance and decision-making practices amongst American Indian Alaska Native peoples. We, in this paper, are describing a few different forms of Alaska Native American Indian governance, perspectives on deliberation, and then areas of overlap, synergy, and conflict. So this process that we were engaging in helped our teams determine that indeed public deliberation may be a good fit, but we wanted to focus in on not only our individual research questions of interest at these 3 different sites, but also have some measurements there in the way of the quality of the deliberation and inclusion in particular. So we wanted to focus in on the social components of deliberation, respectful discussion, equal opportunities to participate, and recognize that there are different forms of governance practices, both historically and more in contemporary times. We weren't sure if the analytic components of public deliberation were going to be a good fit for our discussions and our populations, but we decided indeed we would go ahead and move forward with the conduct of public deliberations in our 3 different sites. Again, though, I still, at this point, many of us that were at our leading our sites did not have a clear understanding of what public deliberation really looked like, and if and what it should include for our specific communities that had differing experiences with genomics research and with ELSI questions. And so what I wanted to share with you was something that I wish we had found earlier. And at least for one of our sites, the site that I was leading, we had put out a paper based on our the deliberation that had occurred, the public deliberation that had occurred here in Anchorage a couple of years ago, where we were focusing on genetic research testing and return of results. And I bring this up because we deliberately published in PLOS One so we could include a boatload of online supplemental materials, including the agenda for the event, the expert presentation discussion points, the opinion poll that we used, the 6 different scenarios that we used across the 2 days, and the summary report that was finalized and sent to participants. So in this particular event, we were focused on 2 different questions. What are the potential benefits and harms of genetic testing and return of results? And what are the potential benefits and harms of direct-to-consumer testing? And the individuals that were in this deliberation were from our urban center of Anchorage. They included American Indian and Alaska Native people that are here in our urban center that are all receiving healthcare from the Alaska Native Medical Center, which is a group that is owned and managed by a consortium of Alaska Native tribes. Here I bring up a slide that describes the overall process for the deliberation. It includes a planning stage, the deliberation stage that's in the blue and gray in the middle, and then the report phase. And again, as a person that is developing and directing projects, I wanted to know more about each one of these phases. And I really appreciated the previous presenters that also described a lot of the ins and outs of the conduct of concept mapping that was inclusive of planning, the doing, and then later the analyzing. Here in the planning phase, I just wanted to mention there are a lot of meetings, right, in the planning phase between research team members, such as myself, that's community-based and placed, and my team, our partners that are also community-based and placed, and our university partners that were at University of Oklahoma. Also, we had a consultant from University of Washington, and we needed to come together to discuss, describe, and plan what we were doing and what would be done similarly across sites, but also individual work. This is where our recruitment strategies were hashed out, the development of different tools, the printing, mailing, staffing of the event, all of that jazz. And then in the middle, you have our deliberation event. This is where we needed to pay for catering for the thing, for the event. We had plans around staffing, the conduct of the informed consent process prior to the event, deciding on and monitoring and managing the location, distributing polling information, discussion prompts, managing the plenary events and group debriefs, and of course, participant incentives. And then in our reporting phase, there was a summary of the deliberation discussion that we had chosen to do, that was drafted by the research team within 48 hours of the event. We made a revision request to our participants, mailed that out. There was an incentive for the completes, and then the research team revised that summary and finalized it and mailed the final back out to our interested participants, tribal leadership, and other interested parties. And then, of course, there was a fuller analysis of the discussion and the deliberation, evaluation, quality, and dissemination of scholarly works. So just real quick, I wanted to give a little example of the first half of our agenda. And here you can see that we planned a nice block of time on a Friday evening for the participants to come and meet the research team, go through the informed consent and registration process. We gave them a catered dinner of Alaska Native foods, and we moved through our welcome, gave them a quick break, and then launched into an expert presentation. Oftentimes in public deliberation, there's expert presentations. I have the presenter notes as an appendix to supplemental material to that paper. And then we moved into a group discussion that was prompted by 2 different scenarios, and we'll move into the scenarios next. We adjourned for the evening and then allowed people to think about what they had just been talking about, and then moved into the next day with a full agenda for that full day. Scenarios were developed in this case by a graduate student, an Indigenous graduate student, and he had developed these scenarios. We had 2 scenarios, so the full group was broken up into 2 smaller groups. Group 1 was given, in this case, this research scenario. Group 2 was given another research scenario. Participants all had hard copies of these scenarios. We asked for a participant in each group to read it aloud. There was discussion and then report out with starting with the reading of the scenario to the entire group. So that way people in group 2 knew what the other group was discussing. And then the participants were asked to share out their thoughts. Then we moved to the next group and then allowed for overall discussion. While the points were being made in the open discussion by both groups and by the entire group, the facilitators were documenting the major points of discussion on flip charts. All of these groups were occurring in person. This is pre-COVID, but deliberation can occur virtually via Zoom as well. During the time that the facilitators were discussing and documenting, they were also asking some probing questions. The facilitators were noting where there was convergence and divergent thinking, and then they sought clarification and discussion on the nuances between different comments that were made by participants. And here's just a quick overview of day 2, showing indeed that we went through this process multiple times, allowing for group discussion on different aspects of our 2 research questions. And then we also polled our participants at 3 different points in time during the event, before it started, in the midst of it, and at the end. And the polling examples we provide in that paper, but here's just one enlarged for you to see with the little Likert scale. Our polling example included a lot of questions on the opinion poll. You can just do one. In this case, we wanted to look at little nuances of some of these constructs. So we had a whopping 18 questions, and that was something that was more extensive than our deliberation consultant had usually used, but it was of interest for our site to understand some of these nuances. We also, as I had mentioned, did a post-deliberation summary that we provide. It was developed in what we hoped would be plain language. It was provided to the deliberants for editing, and then we revised it based on their feedback. So we also put together a quick paper on the shared deliberation process across the 3 different sites. And I will quickly walk through those here. Across our 3 sites, we had decided that the deliberations would all occur in 1.5 days, that they would include shared meals to allow deliberants to get to know one another. And we would go ahead and have facilitators, one who was an expert in deliberation facilitation and another who was a local facilitator. So somebody that understood the community, the context, and some of the jargon of the area. In all of these different sites, we had discussed the stipend, the type of deliberation report that would be provided, and have consistent deliberation team members observing and documenting the deliberations at all 3 sites. We also had a shared deliberation quality evaluation where we had an observer who is experienced at evaluating deliberations utilize a rubric for evaluation quality, and this rubric is included in one of the papers. We also conducted deliberation separately through an R01 that I was PI of, along with Bert Boyer and Erica Woodall, with using enclave dialogues and then a cross-site deliberation. And this was, again, with leaders. In this case, as someone had mentioned earlier, with many of these engagement processes, consensus is not the goal. We're looking for different areas of agreement and disagreement. And so this work was done with leadership from the Yukon-Kuskokwim Health Corporation in the southwest portion of Alaska, leadership from South Central Foundation in the urban center of Alaska, and then the Confederated Salish and Kootenai tribes of Montana. Dialogues were held at the local areas of Bethel, Anchorage, and Polson, Montana between April and May of 2019. And then we held the cross-site deliberation in June of 2019. The individuals that were moderating the dialogues, we had one individual that was moderating the dialogue that went to all 3 dialogues and moderated, and also co-moderated the cross-site deliberation, and then a local facilitator co-moderated the dialogues. And then we had an expert facilitator come in and support the facilitator that was at all of the dialogues in the cross-site deliberation. We hear some information about the local dialogues. These were our enclaves, where we first allowed these participants, these leaders from these areas, to discuss the idea of precision medicine research. We provided them graphical representations of precision medicine research. We provided them some information about NIH's All of Us research program. And then we also used some vignettes of specific types of precision medicine research that were based on research that was occurring in their areas. So some research on pharmacogenetics, epigenetics, and microbiome, as a for instance. Then at the cross-site deliberation, we brought all of the leaders together that were interested and willing to come to the cross-site deliberation, put them in small groups, allowed them to talk within their areas and with mixed groups. And we did different types of exercises that were based on information that was gathered at the dialogues. One of these was a worksheet that we had completed, and this is some information on the worksheet. And you know, we just were able to find that the deliberants really were able to actively dialogue with one another, both in the public deliberations, but also in these leader deliberations. And that as groups were sharing, a lot of information came out that informed the other groups of leaders or individuals in further firming up their ideas on these particular issues. I give an example here that I don't think I have much time for in the way of describing, but it was just an example of how the participants really got into it and into the discussion and were fully engaged. Insofar as determining that the deliberation question that we posed and the types of responses were adequate, and they went ahead and added another option and then discussed it. So I just wanted to present some ideas around deliberations that we had conducted with our American Indian Alaska Native communities, and provide some resources in the way of what these different components in public deliberation might look like, and how you might riff off of those if you choose to do public deliberations in your own areas. I also just wanted to mention that as a qualitative researcher, deliberation does take a different level of facilitation. And so we had brought in an expert in public deliberation facilitation to assist and co-lead all of our dialogues. The intensity of these events was something that we really wanted to have additional expert level support on. And so there's a lot to be said about facilitation of these events and the types of activities that you present to the participants. But I realize we don't have time to get into all of that, but I'd love to hear what questions you might have for me. And many of the papers that I had mentioned in this presentation, I'd be happy to send you copies of. And the information is also available at the Seeger website, and I have that link here. So I'll go ahead and stop my sharing and jump into questions.
Thanks very much, Vanessa. That was really very interesting. We do have time for about 5 minutes of time for questions before we take a short break. The floor is open. You can put your question in the chat or raise your hand or. I'm wondering, have you seen in the different tribal settings, I would imagine that there are different cultural contexts for how the deliberation goes. And I wondered if you could talk a bit about those differences, whether you had to use different methods in order to allow people to really have a voice in the different settings.
Yeah, thank you for that. We did notice some differences between the different tribal groupings, and it really helped with those nuances, those local contextual nuances of different tribal peoples, to have a facilitator that was based in those communities, to be able to understand what was being said, to help the facilitator that was versed in public deliberation, and to really, how do you say it, recognize, acknowledge, and explain to, especially later in debriefs, to the researchers what they've seen, what they might have seen, and how they might annotate things that they didn't understand in nonverbal communication or specific terms that were used. So again, the idea of having a co-facilitated and co-managed deliberation was one that some of the tribal governments insisted upon, but as researchers, we were absolutely grateful for our local co-facilitators.
Other questions?
Yes, please.
Thank you. This was great, and I completely share what you described at the beginning of not really knowing how that would look like a public deliberation. I might have missed it, but could you share a little bit about how do you identify participants and how many participants would take?
Yeah, each one of our sites identified participants slightly differently. With the site that I managed, we wanted to have individuals, because we were asking questions about return of results that would be coming from largely primary care settings. So we wanted individuals that were indeed members of these Alaska Native American Indian communities that had been receiving services, healthcare services from that primary care setting for at least a year. We also recognized that the individuals that were receiving those services may be employees of that agency, because there was a high level of employment of tribal peoples by that facility. So we didn't want to exclude individuals that were also employees of that facility. We were looking for people that were very aware that this was a process where they would be in deep discussion for 2 days straight. And that we really wanted them to be present for that. So we had a lot of just dialogue with them during the recruitment process of, what would this event actually look like, and the expectations therein. And that, I think, did exclude people. They self, said, no, thank you. I don't have time to do that. And one of the things that I really wanted to highlight about the form of public deliberation, the in-person type of public deliberation that we had done, was that it does privilege individuals that can speak, right? So this is not a method that allows for individuals with speech impediments to really feel comfortable. We didn't use closed captioning. We didn't use captioners that were providing that service. There's just, I think, a lot, particularly as I've moved into the field of disabilities, that I note as limitations to the model as we applied it. And so, when we were thinking about who to include, exclude, those were things that weren't on my mind at that time. But now that I am more aware of really how this methodology allows for discussion by some, but probably not discussion by others, I think I would do it differently.
Yeah. Eric, did you have a comment?
I had a question. Thank you for a wonderful presentation, Vanessa. I believe that in one of the papers you cited, the conclusion was that tribal oversight was needed, but in general, there was an endorsement of the precision medicine initiative. And I was just wondering if you could tell us what was the question that was put before the group about which they deliberated. Can you work backwards?
I'm going to try to go back into my my mental archives with that one. There was a split between the tribal leadership that was present and that recommendation. So there wasn't consensus by the tribal leaders over oversight for precision medicine research, if I'm remembering correctly, and forgive me if I'm not. But I believe there was a split decision there. Even within the sites, there would be so we reported on all of the participants, but when we were talking to them, there would be some participants that were indeed endorsing local oversight, and some that didn't endorse that in the same manner. And the question was changed by the participants in the final polling. And let me see if I have that question in my notes. Sorry. Got to flip through a couple screens here. I don't have it in my notes. the final question, because the participants in this dialogue, they had actually changed the question that we were posing to them a couple of times, which shows that they were absolutely engaged with the facilitators. And in that one, yeah, I can't remember what the final question was that was posed to them and how they responded. So I apologize.
No, not at all. Just what motivates my question is I'm trying to understand the connection between the question we ask and the method that's appropriate for responding to it. So in the first case, I really get, there's this, in the case of the first presentation, there's a question about how you get fewer no-shows at genetic counseling interviews. And then I'm trying to understand how that kind of question is similar to and different from the kind of question that public deliberation is meant to address. That's what I'm trying to wrap my mind around.
So our for each one of these 3 sites in the seeker deliberations, each site had a separate type of question. The question that our tribal leadership was interested in was around how ought the should the system provide results back? Who should those results go to? And where does the responsibility for sharing that lie? Is it with the individual or with the health system, or where is the shared responsibility? That system has one of its 3 core values of shared responsibility, but who are the actors in that? And so many of our polling questions in that case had to do with, and I was mentioning nuance in those polling questions, had to do with the what information should be shared, what tests should be offered, who should make those decisions. Should it be the primary care provider? Should there be a blanket decision that's being made by the health system on the whole? Things of that nature. And the same with the direct-to-consumer testing results. As the individuals may be sharing those back with their primary care provider, what happens to those results? And how ought those to be shared within a family or more broadly with others in the healthcare system? So it was
really
that nature.
Sorry, but I'm going to have to
Absolutely.
all time. I'm really sorry, because this is just the kind of conversation that it'd be wonderful to have, but we do have an agenda for the rest of the time, and we've reached the end of our break period. So I'm going to suggest that we just take a 5-minute break and come back. And actually, if you want to converse offline, you could do that, of course. So 5 minutes. I have 2:38 right now. We'll come back at 2:42 or so, 2:43. Okay. Just a quick break. Hi, Daphne.
It's been great so far.
Hi, Maya. Yes. I
Hi,
think so.
really wonderful.
Absolutely.
And hi, Daphne.
Hello, how are you?
Good, and yourself?
Pretty good.
Good, good, good. Looking forward to your talk.
Thank you, me too.
So it is now 2:43, and that's what time I said we would begin again. So if Daphne, if you're ready, I will just give a brief introduction
Sounds good.
and we can get going again. So it's a pleasure to introduce Dr. Daphne Marchenko, who is a postdoctoral research fellow at the Stanford Center for Biomedical Ethics. She works at the intersections of bioethics, the social sciences, and the ELSI of genetics, and on ways to promote interdisciplinary collaborations and ethical responsibility, particularly in social and behavioral genomics. So Daphne, thank you.
Thank you. Thank you for having me. Hopefully people are seeing the right screen.
Looks like it to me.
Okay, great. So today I'm going to be talking about adversarial collaboration as a mechanism to generate productive dialogue on ethical responsibilities in genetics and genomics. And I first want to start by mentioning that adversarial collaboration is an uncommon approach in ELSI, and it is an uncommon approach generally. So making that clear. So for today, I first want to start with a statement of the problem. You know, what is it that leads us to consider an adversarial collaborative approach, then talking about what adversarial collaboration is, what it does, when and why you might use it, and then an example of an adversarial collaboration dealing with an empirical issue, and an example of one applying to an ELSI issue. And I actually have two, but I think in the interest of time, I'll probably only get to one. So disagreement is a powerful engine of scientific advance. It sharpens conceptual boundaries, it directs attention to neglected issue, and it prompts the design of would-be decisive experiments. Understanding the benefits of having disagreement is really foundational to understanding the motivations for an adversarial collaboration. And genomics is an area that has a lot of disagreement. I, as Ruth mentioned, focus on social and behavioral genomics in particular, but there are a number of different facets within genomics that spark a lot of debate, a lot of controversy. In social and behavioral genomics, there are people who believe that this field is opening a new door to eugenics. On the other hand, we have people who are arguing that we should embrace the genetics of education. And to provide context, social and behavioral genomics is research interested in social and behavioral outcomes, things like intelligence or educational attainment, income, externalizing behavior. Those are the kinds of things that are of interest to researchers in social and behavioral genomics. Another topic that is considered controversial in genetics genomics is the relationship between race, genetics, and ancestry. And so there are people who believe that denying genetics isn't shutting down racism, that it's actually fueling it. And there are also who believe that changing the wrapping won't fix the genetic racism package. So the cumulative impact of genetics research has led to and sustains racism, and change is needed if we're to imagine a world where genetics doesn't fuel racism. As I entered the field of ELSI, I found this polarization to be a bit disheartening. And it's not because there was disagreement. I think disagreement can be very generative, as I started off with. But it seemed to me that we were talking past rather than with each other. And this talking past each other is happening while industry is running away with uses of genomic data. So there are direct-to-consumer genetic testing companies that are offering premature, overly simplified, inaccurate, or even risky for-profit services. This includes, through more basic genetic testing that people might do for something like educational attainment, but it also includes bigger things like polygenic embryo selection. So trying to utilize polygenic scores, which are a measure, an estimation of risk using for complex behaviors and traits. So polygenic scores are increasingly becoming abundant within genomics, and so people in industry are beginning to try and apply polygenic scores to in vitro fertilization services. And so while industry was running away, is running away with genomic research, I thought, what are we going to do about this? And the problem, I think, when it comes to engaging with controversial areas of research is that we often do angry science. Danny Kahneman, who you will get to know a little bit more shortly, described doing angry science as a demeaning experience and felt that he would lose his sense of objectivity when engaging in a point scoring mode. And when we do angry science, we traditionally do that through point-counterpoint exchanges in journals. You might think of Twitter exchanges as another example of doing angry science. But these kinds of approaches to dispute resolution can make it too easy for parties to hunker down in impenetrable theoretical bunkers to talk past rather than with each other. And so even though I've said that disagreement can be generative and productive, it can also be unproductive. And the unproductive nature of disagreement is not going to help us at countering the limited protections that we have in the United States, for example, around genetic discrimination. It will not help us to identify ways to address and rectify the Eurocentric biases within genomics. It won't help us to think through continental groupings for genetic ancestry, whether that's appropriate. These are factors that are likely to exacerbate rather than ameliorate health disparities. And so if we have disagreement that is operating, I use this analogy here of two parallel railroad tracks. If we're working on these two parallel railroad tracks and not in meaningful dialogue with each other, then we're not going to be able to productively address some of the really big pressing issues in the field of ELSI. I think that it's important to find ways to make disagreement more productive. And I think it's important because ethical and anticipatory genomics research, especially on human behavior, because that's the area that I've been focusing on, means that we need to celebrate disagreement. And I can put this paper into the chat, but it introduces what's about to come next, which is adversarial collaboration. So adversarial collaboration is a shift from a closed-minded adversarial system that rewards tenaciously defending extreme positions to a system that encourages open-minded exploration of the boundary conditions. And as I've said already, it is primarily used as a way to make controversies more productive and constructive. So going to Eric's question about, in what situations is this particular method most suitable, adversarial collaborations are most suitable in situations where the question at hand is considered to be controversial, where there is a lot of polarization at hand. Adversarial collaboration is a good faith effort to conduct debates by carrying out joint research. And you can see that these are both coming from Daniel Kahneman, who's pictured there on the right, of course, a much younger version. For those who don't know, he is a behavioral psychologist and a Nobel laureate in economics. And he is considered the person to come up with the term adversarial collaboration. And he used it to try and resolve empirical disputes, which is why I'm going to present an example of an adversarial collaboration dealing with an empirical dispute, and then present an example of one dealing with an ELSI-related issue. I also want to acknowledge that at first glance, I know that the term adversarial or hearing the word adversary can carry a negative connotation, but adversarial collaborations are really designed to build constructive conversations, to insert that switch line from the two parallel railroad tracks that we might more often operate in when it comes to controversial issues. Adversarial collaborations disrupt the silos in which academic research is produced, and the overarching aim really is to facilitate an inquiry-based approach to a subject, to surface values that previously may have gone unnoticed. One of the most helpful elements of an adversarial collaboration is the opportunity to clarify potential misunderstandings, to really understand what the nature is of the disagreement. Why is it that this question that we're coming together to discuss is controversial? Kahneman, in a paper reflecting on his experiences with adversarial collaboration, said that all the ones that he was describing in that paper, all 3 adversarial collaborations ended with some new facts accepted by all, narrow differences of opinion, and considerable mutual respect. So those are indicators of success. Like deliberative democracy, consensus is not the goal of an adversarial collaboration. In fact, for topics that are considered to be very controversial, the pressure to arrive at consensus can stifle dialogue from happening. So adversarial collaboration explicitly is not trying to seek consensus. What does it do? Well, it calls on sides to be preemptively self-critical, to understand and be able to articulate your own perspectives on the debate at hand, really deeply be able to understand and articulate it. We also need to reflect on the dynamics of the debate at hand and identify the level of flip between the available data and the claims about that data. So what is the fit between what data is available out there and what my beliefs are, or what I'm extrapolating from that data. Another aim of adversarial collaboration, or what it does, is to identify pivotal points on which parties can either agree or agree to disagree. So really outlining the contours of disagreement. And it helps us to think about conditions that have the potential to induce both sides to change their mind. So thinking through whether there are certain changes that would need to happen in order for people's perspectives on a given issue to be different. And finally, adversarial collaborations flush trade-offs into public view. Now, one should engage in an adversarial collaboration not because you find your adversaries or their positions congenial, but instead because you recognize that the credibility of your science hinges on science's capacity to transcend ideology. And also because the usual method of conducting the debate cannot break through the complex defenses that each side can use to neutralize dissonant evidence. So again, this has to be a really quite strong debate, controversial debate at hand. And I'm going to keep emphasizing that the problem adversarial collaborations are moving towards are ones that are considered to be polarizing, contested in nature. The challenging thing is twofold. The first is that adversarial collaboration is most feasible, it's easiest to do when it is least needed. So when the clashing camps or opposing sides have advanced testable theories, when they subscribe to common canons for testing those theories, and when the disagreements are robust but respectful, those are situations where it's going to be easiest to do an adversarial collaboration, but also where it's least needed. On the flip side, adversarial collaboration is most difficult in situations where it is most needed. So when the scientific community lacks clear criteria for falsifying points of view, when people disagree on key methodological issues, and if we are fractured into opposing camps that see any concession as weakness. Because of that, choosing who you engage in an adversarial collaboration with is really, really important. And adversarial collaborations are most likely to be successful in the murky middle, especially in high policy stakes and low trust debates. So I will talk through a little bit later about thinking through choosing an adversarial collaborator. But if we were to think of a particular issue and people being at complete opposite ends of the spectrum, an adversarial collaboration might be more productive between people who are not at those extremes, but are more towards the middle. And even though they are more towards the middle, they are still capable of speaking to the people who may be at the more extreme ends of the debate. So the hope is that in coming together and identifying these tensions, these areas of disagreement, you will be able to inform a broader audience. Bring together perspectives that may traditionally not be in overlapping circles. So here is an example of an adversarial collaboration that Kahneman was a part of. This is an adversarial collaboration to resolve an empirical dispute. In this case, the controversy at hand was biases in probabilistic reasoning in general and conjunction effects in particular. Want to just add this clarification here, which is that when I get to an example of an adversarial collaboration in ELSI, controversy takes on a little bit of a different meaning. Controversy takes on meaning that is more related to some of the upfront background that I provided around the polarization around genomics research, around social and behavioral genomics, around genetics and race. So, but in this case, the controversy was around conjunction effects and what is a conjunction effect. I am not an economist, I'm not a psychologist, so I'm not going to do service to this in the way that I should, but just to give folks a general understanding, a conjunction effect occurs when it is assumed that the specific conditions are more probable than a single general one. So for example, if you were told that Linda is 31 years old, she is single, outspoken, and majored in philosophy, and if you were told that as a student, Linda was deeply concerned about issues of discrimination and social justice, and that Linda participated in anti-nuclear demonstrations, if you were given that information and then asked which of the following is more probable, 1, Linda is a bank teller, or 2, Linda is a bank teller and is active in the feminist movement, more people would likely select number 2, that Linda is a bank teller and is active in the feminist movement. This is even though the actual probability of these two events occurring together is less than or equal to the probability of one of the events occurring together. So even though people will say Linda is a bank teller and is active in the feminist movement, that's more probable, the reality is that it's more probable either that Linda is a bank teller or that Linda is active in the feminist movement. But bringing the two together is less probable than one on either side of their own. So the disagreement here was about, understanding conjunction effects and what's going on there. The parties at play here were Danny Kahneman, who is in psychology and economics, Ralph Hertwig, who's in psychology, and Barbara Mellers, who is also in psychology. And Barbara acted as an arbiter, and I will explain what an arbiter is, because that can be pretty important in an adversarial collaboration. So the process here began by identifying what they agreed and disagreed about. They then had short debates on the issues that they disagreed about. Given that this was an empirical dispute, they decided on 3 empirical tests for resolving the dispute. One was jointly devised, so Hertwig and Kahneman came together to devise a joint empirical test. And then Hertwig developed his own empirical test and Kahneman developed his own empirical test. Each of these empirical tests were meant to resolve the dispute or, given the disagreements between the two, to help illustrate that the position of each respective party was correct. So Hertwig's experiment empirical test was designed by Hertwig in hopes that it would become clear that the outcome of that empirical test would show that his position was correct. They then went ahead and conducted the experiments and discussed where agreement emerged and where disagreement remained as a result of those empirical tests. And their measures of success for this adversarial collaboration was the extent to which there were surprising results, insightful discussions, and testable hypotheses about outstanding issues. So important to note that success was not gauged by there was a conclusion to this debate. Everything became all clear and wrapped up nicely after. The papers that emerge from these kinds of adversarial collaborations are fairly unique. So they include an introduction methods and results section like many papers do. But then Hertwig and Kahneman, or whoever is a part of the adversarial collaboration, was given the same amount of space within the paper to articulate their views. So this results in a joint publication, but with clearly delineating what the respective views are of each of the parties involved in it. And coming out of this example that I've just provided, the team offered some suggestions for others who were interested in doing adversarial collaborations. This included that participants should seek to identify results that would change their mind, at least to some extent, that an arbiter played an important role in this case and should take responsibility for several facets of the adversarial collaborative endeavor. And that delay is likely to breed discord. So all experimentation and writing should be done quickly with deadlines agreed upon in advance. Setting the ground rules are very important. But even though there are suggestions here offered for adversarial collaboration, it is neither possible nor perhaps even desirable to set out guidelines for adversarial collaboration that cover every eventuality. So in this regard, I think there is some overlap with what Vanessa has mentioned, in that each adversarial collaboration, like a deliberative public deliberation, is going to look different. There is no one-size-fits-all approach. Other examples of adversarial collaboration have focused on issues in psychology, in economics, philosophy, and the basic sciences. So it has been applied to explore a range of different areas. And I have been interested in trying to apply it to examine ELSI-related issues, ethical, legal, social implications of genetics. And so the goals of adversarial collaboration in ELSI specifically is first to bring together different epistemic cultures. And so what I mean by that is to bring together people that have different sets of norms, values, beliefs, and traditions. Why? Because epistemic cultures guide how members of a field propose, communicate, evaluate, and legitimize knowledge. Another goal of an adversarial collaboration in ELSI is to map the contours of disagreement around complex and controversial questions, such as, for example, do genes matter for social inequality, or are genes changing our understandings of race? So here, again, the definition of controversy in ELSI is a little different to the definition of controversy that, say, Kahneman is applying in his empirical collaborations. And also, like other adversarial collaborations in ELSI should understand or seek to understand the trade-offs that researchers make when answering these controversial questions. It is most appropriate when dialogue between epistemic cultures is perceived as necessary to answer the research question. So in order to answer the question at hand, for example, do genes matter for social inequality? You need people that have different sets of norms, values, beliefs, and traditions, because you want to understand what it is that makes that question controversial. And the question at hand has no clear answers. It's controversial. And the nature of what makes it controversial is unclear. For example, you don't know if it's a matter of language or definitions or values or baseline assumptions that is making this such a polarizing question. And then finally, it is most appropriate when the policy stakes are high. So, I provided those examples of the polygenic embryo selection, of direct-to-consumer genetic testing, of industry applications of genomic technologies, but trust between parties is low. And these collaborations can conclude with agreement or disagreement about the validity of the research question and the method for answering it. So, for example, people may engage in this adversarial collaboration, may wonder whether there are other questions that we should be asking that better set us up to engage in the conversation that brought us into the adversarial collaboration in the first place. So, for example, if the adversarial collaboration was about this question of do genes matter for social inequality, there may be a set of prior questions that need to be grappled with before one can meaningfully engage in this question, do genes matter for social inequality? And so it may be that there are identification of different or more appropriate research questions for exploration through these conversations. So, for example, is it also important for us, if we're again thinking about this question of do genes matter for social inequality, is it also important for us to understand how do genes affect the world and what people mean when they ask that question? And then it may conclude with, ideally, each participant more aware of their own assumptions, the trade-offs that they are making, and better able to articulate the contours of agreement and potential disagreement. For example, do I better understand how I and others are thinking about this issue and why they are thinking about this issue in the way that they are? ELSI adversarial collaborations I've broken up into 2 phases here. Phase 1 is really about laying the groundwork for a successful adversarial collaboration. So you want to select participants who may hold not only divergent opinions on the research question, but also disagree about the validity and methods for answering that question. So different epistemic cultures. You also should determine whether you need a trusted colleague to coordinate the effort. So in the Kahneman example, they had a neutral arbiter. The same thing applies in adversarial collaborations in ELSI, figuring out if you need to have someone to help referee the disagreements and collect the data, and to ensure that there are accurate and thorough recordings of discussions. In phase 1, you also should recognize that education may be necessary, given that these different epistemic cultures are coming together. There may need to be some education that happens to help build the foundation necessary to engage with the research question. And you have to accept that it's going to be difficult, that the discussions will be challenging, they will be time consuming, and consensus does not determine success. So do not set that as the end goal. Again, as with the empirical example, delay is likely to breed discord, so agree upon deadlines in advance, establish regular touch points, and agree that one of the goals of the adversarial collaboration should be to deliver an output that will have participants as authors or named collaborators on it. What that specific output looks like does not have to be determined until later, but setting it up front, that you want the parties to come together to create some sort of product that can inform the broader audience. In phase 2, you want to begin by understanding. So this is once the ground rules have been laid out, and you're starting the heart of the adversarial collaboration, you want to begin by understanding each participant's values, priorities, and reasons for their beliefs. Ideally, this process will illuminate their attitudes towards truth and knowledge, and how those are constructed and determined. So you'll want to understand how participants identify common terms, what are their values, and how do their values relate to their perspective on the issue at hand, and what, if any, do participants think are the best methods for arriving at an answer to the question? How would they go about answering that question? Once areas of agreement and disagreement become more clear, participants should collaboratively reassess the research questions to identify whether there are more suitable ones for discussion, and unpack why different questions to the original one that facilitated that adversarial collaboration might be necessary. Participants should also seek to identify outcomes and conditions that might change their responses to the research question, and should anticipate their interpretations of outcomes or conditions that would be inconsistent with their expectations. So these potential outcomes and conditions and their possible interpretations should be recorded by the arbiter. And this is really, really important. So people thinking through not only what their position is on the question, but if there are certain conditions, certain things that would need to happen in order for their position to change. The data, so video recordings, meeting notes, etc., should be under the control of the arbiter if there is one, or recorded in some other sort of systematic fashion. And any disagreements that come out of the dialogue throughout an adversarial collaboration should be made publicly available, because that is a really important facet of adversarial collaboration, is understanding what the disagreements are. Finally, participants should identify potential audiences and outcomes for communicating the research questions, capturing the discussions, and outlining disagreements and agreements. So I'm going to present, as I suspected with time, I only have time to present one example in ELSI. This is an ongoing example, so it's not done and dusted and finished in any way that I am involved in. To go back to some of the steps that I laid out in the last two slides, remember that step one is to select participants who may not only hold divergent opinions on the research question, but also disagree about the validity and methods of the initial research question. So this is a collaboration between myself and Sam Trejo, who is an assistant professor at Princeton in the Department of Sociology. He is a social genomicist, so he utilizes genomic data to conduct questions that he believes are of social science relevance. We have collaborated on other adversarial collaborations prior to the one that I'm going to talk about here. And so we know that one, education is going to be necessary to help us work together, that we're going to have to teach each other throughout this process, and also that these discussions are going to be challenging, and we will not likely arrive at consensus around everything. In this case, we do not have a neutral arbiter, but to prevent future disagreements about remembered interpretations and conversations, and to ensure that there's an accurate and thorough recording of our discussions, we use Zoom as our arbiter and record our conversations. Again, as spoken about previously, delay is likely to breed discord, so we have agreed upon deadlines. We establish regular checkpoints by meeting weekly. And we do have agreement about, in advance, about an output, which is a book that we are working on titled Debating DNA. Our impetus for this book is that the challenge facing the field of social genomics, that is grappling with the scientific nuances of genomic analyses of social traits, while also trying to navigate genetics' powerful and contested grip on the popular imagination, that this challenge is too expansive for any one group of thinkers. So we think that the issue at hand requires different epistemic cultures to come together. One chapter that we are in the process of thinking through now is this question of, do genes matter for social inequality, and trying to understand the nature of the controversy, the debate around this issue. These are just two examples of folks who have different perspectives on this question, do genes matter for social inequality? Some people think that genes do matter for social inequality. Others believe that genes do not matter for social inequality. So these are just two examples of individuals besides Sam and I who are interested in this question of, do genes matter for social inequality, and have different orientations towards the issue. As Sam and I are trying to understand the nature of this disagreement around this question, we realize that there are some prior questions that we need to first answer before we can get to what is it that makes the question, do genes matter for social inequality, so controversial. The first is, how do people conceptualize social inequality? For instance, to what extent do they see structural inequality as something that encompasses all of social inequality? Are they defining social inequality as synonymous with structural inequality? Also, how do people conceptualize genes affecting the world? So do they focus on genomics research or analyses, or are they interested in the social impact of genomics on how we think about ourselves and others? Of course, there is a spectrum here, right? So there's a spectrum between people who think that inequalities are deserved and people who think that they're undeserved, just as there's a spectrum between people who think that genes matter and people who think that genes don't matter. Part of our adversarial collaborative effort is to try and understand what this spectrum is of different orientations. And this also includes a spectrum around the genomic research risk-benefit calculus. So some people might see that there is just promise in genomic research, that the benefits far outweigh the risks. In fact, there may be no risk or minimal risk, and others see a lot of risk in genomic research and are very concerned about it. And then there's a spectrum of people falling somewhere in between those. So I'm running short on time, but as we've been thinking through this issue, we've been thinking about people conceptualizing inequality in different ways. One way being the extent to which a person believes that structural inequality encompasses all of social inequality. And people also conceptualize how genes affect the world in different ways. So one way could be the extent to which someone focuses on genomics research to answer questions about how genes affect the world, or examine genetics' hold on the popular imagination. So I'm just providing these to give a sense for the process of us trying to understand what the nature is of the disagreement around the question, do genes matter for social inequality? So in summary here, adversarial collaborations in ELSI are most appropriate when dialogue between epistemic cultures is perceived as necessary to answer the research question. So for example, if we want to answer the question, do genes matter for social inequality, we realize that we need an expansive group of people or different epistemic cultures to come together to try and answer that. It is also most appropriate when the question at hand has no clear answers. It is controversial. And the nature of what makes that question controversial or contentious is unclear. So is it contentious, is it controversial because of differences in people's values, in how they're defining common terms, in their assumptions, in their epistemologies? The nature of an adversarial collaboration is to try and really unpack what is the heart of the controversy. And then finally, it's most appropriate when policy stakes are high and trust between parties that are needed is low. All right, I think I've hopefully left at least 7 minutes for questions.
Well, 5 anyway. That was fabulous, Daphne. I'm sure we'll have some comments. It occurs to me that in order to do this, you have to have tremendous courage.
And patience.
Yes.
Oh, hi, Ruth. It's interesting that you said that. This is Lynn Petrakova. That was a great talk. Thank you so much. But that is one of the things I was thinking about, especially in comparison to the 2 previous talks where they spoke about engaging different stakeholders, stakeholders with I don't know, different levels of, I don't know if power is the right word, or comfort in exchanges with different stakeholders. And so I'm wondering like how you ensure that voices are protected or incorporated into the dialogue when there could be some either actual or perceived difference in the level of, I don't know, power.
Yeah, that's a really great question. So I think there are a couple of things that are relevant here. The first is, when I spoke about phase 1 and kind of establishing the ground rules for an adversarial collaboration, that is really, really critical for getting people at least on the same page in terms of what expectations are moving forwards. In the example that I had provided of the collaboration between Kahneman and Hertwig, they in the publication or the output of their adversarial collaboration, you'll notice that they were given the exact same word length to share their views on the process of being in disagreement, debate, and work collaborating together. So that is one way to at least ensure that in the output that parties are given equal opportunity to share their voice. But I think having especially in conditions where there's concern about potential power differentials between parties, having a neutral arbiter there as someone who can take a temperature read and help to ensure that parties are able to voice their concerns and are feeling comfortable enough to do that is really important. So I would suggest that in conditions where you know that going in there will potentially be these power differentials or perceived power differentials, to have that neutral third-party arbiter play a role and be present as a part of it.
That was great, Daphne. I'm wondering, do you have examples where it's more than 2 people in this type of exercise?
Yeah, I do. But you do raise a good point around size, which is, given how difficult this kind of endeavor is, having too big of a group size is not going to be especially productive in an adversarial collaboration. So that's a good thing to keep in mind, is being cognizant of the size of the collaboration and ensuring there aren't too many parties. At the end of my presentation, I had a couple of other examples, one of which included four parties, and another that included 3. But I think being really aware of group size is an important point that you've raised.
So Daphne, just kind of following up on this, how can you scale up this work? Because ultimately, when you think about reaching a new consensus, or not consensus, we're not trying to reach a consensus, but trying to lay new grounds, reaching levels of agreements that everyone can live with. you kind of want to go beyond the 2 people or the 4 people. How can you scale it up?
Yeah, that's a great question. So, when I had provided that figure that was talking about the murky middle in terms of who might be most productive to come together in an adversarial collaboration, I meant that to demonstrate that the goal, one of the goals of an adversarial collaboration is to be able to inform a broad audience. And in order to be able to inform a broad audience, you need to have people that can speak to and understand the different audiences, the different publics that should have a say or are interested, to whom this issue is relevant to them. And so I think the output of adversarial collaborations are important for expanding impact, because a successful output of an adversarial collaboration is going to bring together a very diverse, wide, encompassing group of people who hopefully will be able to look at it and see that there are orientations that are captured in that collaboration that speak to their own orientations. And I think for issues that are very controversial and very polarizing, where we're operating on those 2 parallel railroad tracks and not always in dialogue with each other, the first important step is to be in dialogue with each other and come to the table. And so the hope is that through adversarial collaborative models that are celebrating disagreement, we can bring more people to the table in the outputs of an adversarial collaboration. So I hope that helps you understand kind of where in the pipeline, where in the process it is.
Thank you.
Okay. Unfortunately, we have to stop. And Daphne, that was fabulous. I wish we had more time for discussion. And I hope that people can stay for 5 minutes after 4 o'clock, because we want to give enough time to Alexis to also have questions at the end. So our last speaker of the day is Alexis Walker. And Alexis is an assistant professor here at Columbia in the ethics division of the Department of Medical Humanities and Ethics. She's an interdisciplinary scholar, trained in science and technology studies, and also in medical anthropology and bioethics. And her research at the moment focuses on the social dynamics of health and medical organizations in the private sector. So Alexis, thank you so much.
Hi, folks. I'm so glad to be here with a series of really great talks, and I think a great way in this short course to be digging into methods for ELSI research and thinking about the ways we can grapple with these different perspectives on ELSIs in genomics. Today I'm going to be talking about Delphi methods. So I'm first going to talk a bit about what Delphi methods are, their history, some different types, and then I'm going to spend some time discussing the Delphi process that I'm running currently through my early career investigator award from the National Human Genome Research Institute, NHGRI. So Delphi methods have been done a lot of different ways for a lot of different purposes. A lot of the definitions out there are pretty vague, but essentially a Delphi is a multi-round process of structured group communication. So it does share some interesting things with the concept mapping that we heard about first. So generally, Delphi methods include at least one written round in the form of a survey. So not bringing people all together in person though, but this kind of is similar in the sense of these sort of iterative rounds. So at least one written round, at least 2 rounds total, might be as many as 5 or more rounds of surveys. And sometimes those survey rounds are substituted for rounds of interviews or focus groups, other kind of moderated in-person or virtual interaction. So I can talk a little bit more about the reasoning for that in a minute, but so at the heart, Delphi methods are about gathering group input through a series of rounds. Then in each round, you feed back the responses from the group and back to the group as a whole and allow that to inform their subsequent responses to the following rounds. So the term Delphi comes from Project Delphi, which was an effort sponsored by the US Air Force starting in 1951, was run by the RAND Corporation, which had been founded just a few years before, specifically as a way to make use of American scientific expertise that had been brought together during World War II. So there are some pretty strong sort of nationalistic and militaristic roots of Delphi methods. And depending on time, I know we're kind of short today, we might be able to chat about what it means that the sort of what these roots mean for the role of the method and how we think about it today. But I want to give you the schema first. So the first use and development of the Delphi method was in an effort to bring together expert opinion to estimate bombing requirements. So in 1951. So this and the next couple of slides provide excerpts from that 1962 report that I just showed the cover of that was released by RAND after this project, which was initiated in 1951, was declassified. So as you'll see here, the experiment was, quote, designed to apply expert opinion to the selection from the point of view of a Soviet strategic planner of an optimal US industrial target system and to the estimate of the number of A-bombs required to reduce the munitions output by a prescribed amount. So I was having fun going back looking through these 1960s reports and feeling like I was in the movie Dr. Strangelove, which spoofs RAND. But in any case, I think the history of our methods are important, and I think it's super interesting to look back at and think through. So the idea being here, that the US government had an interest in knowing where the Soviet Union might strike if they were going to try to disable American industry, and what kind of capacity the Soviet Union would need to have in order to incapacitate American industry at different levels. So the project designers wanted to reduce groupthink and make sure that they were getting independent thought from each of the experts that they were enrolling to see where those experts aligned and where they weren't aligned in their assumptions and reasoning on the question. So they didn't want to just bring everybody together in a room and have them have a discussion because people influence each other, especially based on personality or hierarchy. People might not want to speak up if they disagree with someone more senior, right? And some of the things also, even just in terms of in terms of just disability, et cetera, there are plenty of reasons why having a spoken interaction is maybe not the preferred one. So having these as a series of questionnaires can address some of those issues. So the project designers of this initial development of the Delphi wanted to have the opinions of their experts, though, regarding what the most reasonable consensus across their assessments would be. So they didn't just want to have a bunch of assessments and then try to, as an investigation team, figure out, well, where's the middle of these, right? They wanted to enroll the experts themselves in that process. So they wanted those experts then to be able to reflect on the thinking of the other experts without those conversation dynamics. So the solution was to ask their set of experts, which was only 7 people for the original Delphi, to complete a questionnaire where they'd offer their assessment of the targets and number of bombs, et cetera, and their reasoning behind it. And then the investigators took those assessments and the reasoning behind them and provided them back to the other people on the panel, the other experts, and asked them how that reasoning of their colleagues altered or impacted their own perceptions or reasoning, and asked them for a new assessment. And they did that through a series of rounds. And this is what they got. So a series of 5 rounds with moving towards convergence, but not just a simple average of the original positions or even a weighted average, but based each person being able to evolve their position based on each other's reasoning. So the original Delphi form did actually aim for consensus, as opposed to, I think, all of the other methods that we've heard about today. It was designed originally as a decision-making tool. And in the 50s and 60s, Rand continued to develop the method as a way to get expert consensus on complex problems. So some of the best known early uses by Rand were for long-term forecasting, so on the order of 10 to 50 years usually. And forecasting is still a major use of Delphi methods today. So in this study that I have the cover page from here, that is one of the well-known early 60s studies. Investigators asked experts to anticipate developments in a variety of areas. So in science broadly, in space efforts with regards to weapon systems, but also with regard to what they called war prevention. And they, in each of those domains, they asked their set of experts to suggest future possible developments. And then in the subsequent round, they asked all of the experts to estimate a year by which there would be a 50% chance that that development would occur. So this is the way that they went about thinking about future probabilities. And Delphi methods have been used a lot to incorporate expert opinion on issues where there might be quite a range of reasonable possibilities. So instead of, for example, trying to build various computer models that are based on many overlapping assumptions, and a Delphi method is a way to try to tease out some of those assumptions while also trying to reach the most reasonable shared opinion across the panel. So, and in addition to some of those benefits in terms of combining expert opinions, highlighting assumptions, or getting at independent thought, et cetera, sometimes a Delphi method is used because computer modeling in that issue might just be really expensive. So cost is certainly a significant thing to be thinking about. Sometimes a Delphi is used not because of the concern about the in-person dynamics, but because bringing people together, the right people for long periods of time, or for many round after round, might be really expensive. Whereas if you're sending them, if people are around in different places all around the world or around the country, sending them a questionnaire might be a lot more cost effective. Delphi methods also allow you to bring together a number of experts that would likely be unwieldy in a workshop, right? So usually folks recommend 10 to 50 people be involved in a Delphi. Sometimes we see substantially larger numbers for a first round, especially if high rates of attrition are expected. But in any case, certainly, if you have 50 people trying to have a conversation in a room, you don't end up hearing, right, generally from everybody, et cetera. Those dynamics are quite challenging. Certainly, there are other ways that people try to address some of those dynamics, but in an in-person meeting. But in any case, Delphi methods are one way to try to address that challenge of bringing together a greater number of people. So, and I also did want to flag that in addition to this question around, you don't want people to be influenced by maybe somebody more senior to them says something. There are other reasons why anonymity across the participants might be significant. And so that's something that, if it's a questionnaire, then people don't know who the other panelists are. There may be a benefit for that for various reasons. All right, so as I was mentioning, in the original formulation, it's often said that the Delphi method was designed as a decision-making tool, right? You get a group of experts together, you facilitate interaction towards a consensus, and that designates the best solution to a problem. That's how it's conceived. But Delphi methods have also been used for quite a different purpose. So what's called the policy Delphi. Some people have lamented that naming because it's quite different from a traditional Delphi, because the policy Delphi is, instead of trying to get you towards consensus, it's trying to bring out the full range of opinions and reasoning behind them. So usually it's used for as the name suggests, the development of policies. It was first developed in 1969, published in 1970 by Murray Turoff. And so you're trying to get this range of opinions, in fact, trying to promote the biggest range of opposing views so that you can take those into account and the reasoning behind them when making a policy decision. So it's understood as a decision facilitation tool rather than decision-making tool. And also the folks the panelists in a policy Delphi are not generally understood as experts. They're there as informed participants there to share their values. And so since the 1970s, people have used various combinations and permutations of Delphi and policy Delphi methods. One paper that I like quite a lot is this 1995 piece by Robert Delow, which was published in Applied Geography, where he reports on the methodological aspects of a Delphi that he had run alongside a larger team. And in that case, the investigators ran a simple 2-round Delphi and used that as a basis of a workshop, which is a nice combination that we see a fair amount. So the Delphi helps map out people's positions and reasoning. And then the workshop allows people to delve deeper into those issues or follow up on them with perhaps a smaller group. For example, you maybe have 50 people in the initial, and then you have 15 people for your workshop. And that's actually, it was 40 and 15 in this case. So the level of sort of supporting reasoning for people's positions that you can get from a written survey depends a lot on the nature of the group, right? How committed they are to your issue, the demands on their time, whether it falls in their professional or personal capacity, right? Sometimes you'll run a survey and people are going to write out, are happy to write out for you tons because they're really invested. And sometimes it's really hard to get people to write out their reasoning for you, right? So the Delow piece, and that's something then to take into account for whether, how you might combine written and in-person or virtual meetings, et cetera, synchronous meetings. So the Delow piece reports on a policy Delphi that was meant to support water management decisions in the context of climate change. So the investigators were trying to determine in the Grand River Basin in Ontario, what, if anything, they said should be done at the time to deal with future surface water flows, decreases in surface water flows due to atmospheric warming. So the stakeholder groups that they were interested in involving included water planners and managers, local and regional politicians and administrators, academics, environmentalist groups, et cetera. And for the first round, they asked respondents in this written questionnaire to suggest steps that ought to be taken to respond to future decreases in stream flow at various levels. So at 20, 40, and 60%, a low, a medium, and a high scenario. And for that first round, the investigators sent out just shy of 200 questionnaires and got back about 40. From those 40 questionnaires, respondents provided over 300 suggested actions. And some of those, of course, were sort of different versions of the same suggestion as we were hearing in concept mapping. And so they narrowed those actually quite a lot down to 70 options that they provided back to respondents in the second round, where they asked respondents then to rate their support for the various actions for each of the scenarios, high, medium, and low. And then they asked for people's reasons, and they really stressed to the respondents the importance of providing those reasons for their ratings. Right, so they asked people to rate if they strongly support, weakly oppose, strongly oppose whatever particular action, for example, limiting urban development in wetland areas. So then after those two rounds, which is the whole Delphi in this case, the process yielded a set of proposed actions and their levels of support. So, and for each one, you got the reasoning. So when we come to limit urban development in wetland areas, which we'd seen from in the previous slide, in the 20% reduction scenario, we've got the level, so the issue, sorry, there we go, the level of support and the reasons. This right image is just a zoom in of the left. I wanted you to be able to see this full form, so you got reasons for strong support, reasons for weak support, etc. So They also do report here a couple of other measures, consensus and polarity. I'm going to talk about those in a second when I talk about my current Delphi process that I'm running. I've used the Delo method as a basis for that study. So I'll dig in a little bit to what those calculations are in a minute, but just to close up on the Delo study, they use this Delphi, as I mentioned, as a way to sort of as the basis for a workshop where they then brought people together to figure out which of the suggestion actions together make a good comprehensive policy package. And for example, what agency ought to be responsible for implementing what, et cetera. All right, so a non-health example, but nonetheless a really, I think, useful one, and also really pretty foundational in the policy Delphi literature. So to talk a little bit about the policy Delphi that I'm currently running. So I have a K99 ROO, so an Early Career Investigator Award from NHGRI. And the project is focused on investigating how people who work in human genomics in the private sector, in the US specifically, think and talk about the ethical and social dynamics of their work. And then also what steps might best address some of those issues that they see. So the private sector genomics industry includes companies that are developing sequencing technologies, clinical genetic testing, be that for adults or in the prenatal context, companies that are using genomics to identify drug targets, using cell-free DNA to monitor disease or diagnose, or some of the companies that Daphne mentioned in our last talk, et cetera. So there's quite a range of private sector genomics companies. This is a graphic from a private equity firm describing some of the domains of the genomics market that they see. And really huge amounts of capital are being invested in to develop these products and services. And so I'm just mentioned this as a bit of background, so we think about where my study is coming from before we dig into it. So, in the fall of 2020, it was announced that Illumina, a prominent sequencing company, had planned to acquire the cancer genomics startup Grail for a cash and stock consideration of $8 billion. But even prior to that, Grail had already raised $2 billion from private investors for research and operations on their early cancer detection tests, which is double NIH's total annual funding for all cancer genomics research. So the private sector genomics industry is a really key arena where new technologies are being developed into the products and services that are going to guide clinical practice, research efforts, consumer technology, et cetera, for years to come. And the idea behind my project is that understanding the worldviews of people who are working in this arena is really important to understanding directions of this industry that is shaping the future of medicine, but also the possibilities for pushing towards greater justice in and through private sector genomics. So the goal of greater justice, though, really requires the participation of members of the industry. So having their ideas on desirable and feasible steps on ethical issues ought to be really helpful in making substantive steps forward. And you'll hear again that sort of this rating of desirability and feasibility, the first team was rating importance and feasibility, I think. So these are categories that some of these deliberative exercises are trying to get us towards. So when I'm talking about the importance of industry perspectives, it's not to say that the issues that concern members of the private sector genomics industry are the only important ones in that space. Bioethics scholars might see a different set of issues, but perspectives from the industry are really crucial to being able to make change in that space. So my original training is in science and technology studies. My original training is in biology as an undergrad, but as my doctoral level training is as a qualitative social scientist. And with my K99 ROO, I did additional training in Delphi methods. And so the way I structured the larger project was to start with a series of interviews with folks in the private sector genomics industry, in part because that's my original methodological sort of wheelhouse, and I could start those while doing my Delphi training, but also because starting with interviews allowed me to use a grounded theory approach to the work. So with grounded theory, rather than coming to the project with your framework as a researcher of what arenas matter in the space that you're studying, you let those emerge from the research. So it's a much more open-ended approach to research, certainly than hypothesis-driven work, but even than other kinds of inductive work that starts with more circumscribed categories. So, of course, as a researcher, you always come with at least a basic framework of what you're looking at, certainly with your own ideas about what matters based on the literature, et cetera. So for example, in this project, I was looking at how people who work in genomics in the private sector think about ethical and social issues specifically. Those are the issues that I chose to be looking at, but I didn't determine ahead of time that I was going to focus on their perspective specifically on privacy or on diversity, et cetera. So I let those questions emerge from the research. And both in the original interview round and then I should be careful a little with the terminology. So the interviews I have framed as being a separate study than the Delphi study. Really, the interviews, they're not, I didn't conduct them with the same group. So that they're, those I conceive of as separate, right? A set of interviews that I did initially informed the design of the first round survey of the Delphi study. So both of those methods, though, I sampled broadly across the private sector genomics industry in the United States, across company types that I was mentioning earlier, primarily focused on CEOs and founders, but also across leadership level positions. And in interviews, I asked people first, really broadly, are there elements of private sector genomics research and practice today that you find concerning or you think we ought to be careful about? And then after discussing that, I asked more specifically about what they see as pressing ethical and social issues in their work and in the industry. And that allowed me to dig into how people were thinking about what were ethical and social issues. And it allowed me to orient then the next phase of research, which was thinking about possible solutions or step forward towards the issues that were expressed by my interviewees. So my Delphi process was focused on that, on identifying a range of responses or steps forward, possible solutions on the series of issues that were raised in the original interview research. So in the first round of the survey, I asked people to rate their level of concern on 15 issues from the interviews. And the rating options, there was 4 levels of concern: extremely concerned, quite, somewhat, not very. And then after, essentially, when I did the analysis, I gave those categories corresponded to numbers, right? 1, 2, 3, 4, which allowed me to calculate an average as well as measures of consensus and polarity. So this was based on Delo. So the initial study, several following papers. So here, a high level of consensus reflects at least 70% of responses in the same category. So 70% of your respondents gave the same answer. Or you have 80% in 2 contiguous categories. So like extremely and quite concerned, the top 2. Likewise, a medium level of consensus is at least 60% of ratings in a single category, or 70 in 2 contiguous. Low goes down to 50% in one category, or 60 in 2 contiguous. And anything below that is rated as no consensus. And so the way that when Delo and in the way that I've conducted as well, you don't report then, you don't report an average then, because if there's no consensus, it doesn't make sense to have an offer to say, here's the group's overall average level of support or concern. So that's not reported in that case. And then also measures of polarity, which is done as variance of distribution. And if it's below 1.2, that's taken as no polarity. So to see, right, whether responses were grouped on either ends of a scale as opposed to grouped on one end or spread across. So I'll give you a snapshot of my results. There's a lot here, but I'll zoom in a little bit. Okay, looking at time. Okay, so these are listed from highest to lowest level of concern from the round 1 responses. So you'll see that the greatest level of concern was a lack of diversity in genetic data sets. So 75 out of 111 respondents rated themselves extremely concerned. And then if you take those top extremely and quite concerned, those two categories, that's 92% of the respondents. So that was a high level of consensus. And that high level of consensus was only otherwise reached with overregulation of the genomics industry, where folks generally were much less concerned, right? So there was a high level of consensus, but not a high level of concern. There were 83 out of the 110 people who responded to that question, so that's 75%, rated themselves either not very or only somewhat concerned about overregulation currently of the genomics industry. So that differs from the sort of pattern of responses, differs quite a bit from a couple of others here. The police use of public genetic databases to track relatives of people who have uploaded data, and also companies complying with police warrants to search genetic databases. And the answers for both of those were really quite spread across, pretty evenly across the range. And so there was no consensus there, and you don't report a concern or support level because it doesn't, of course, as I was mentioning before, make too much sense when there is no consensus. So then the second round, which I'm in the midst of now, I had designed as a series of moderated focus groups, and in those, I present the results from this first round and ask participants to, as I do that presentation, look out for what possible steps could be taken to address these issues. I ask them to think broadly about actions by any party, whether that's industry groups or individual companies, whether that's various government agencies or various levels of government actors, whether it's by the research community, journal publishers, funding bodies, et cetera. And then I've run so far 2 of these initial focus groups, and I have several more planned. We have a discussion about what can be done. And the reason it's designed that way is that I had designed it that way was for us to be able to dig a little bit deeper into some of the reasoning behind the responses to round 1, and then also the reasoning behind the steps to be taken, because it's great if you can get that in written form, but it can also be quite difficult to go all that deep in the reasoning behind things in a written format. So I've done that through a series of focus groups. It does sacrifice anonymity across the participants that are in that specific focus group. But after that, I have a third round of the Delphi that I'll run where I ask participants to rate first the desirability and then the feasibility of the steps that were proposed in the focus group round. And that allows me to to sort of recover some of the more independent thought. So I think we're sort of, we're in the interest of time, I have a few more things I was going to mention, but I think the sort of basics here around, how a Delphi process and the difference between a Delphi and a policy Delphi are some of the key things here. So I'd be happy to answer any questions, and also people can feel free to email me.
Thank you so much, Alexis. As a relentlessly quantitative person, I was wondering about whether you had looked across those categories to see whether they whether the responses cluster. Are there groups of categories that go together?
So that is something that I haven't yet done, but it's something that I've been thinking that would be significant to a follow-up analysis. Yeah, so I'm still working on some of the analysis here. I do think it's likely. I mean, certainly the the two police questions, one can guess that I have the hypothesis that those are the same people answering the same way.
Yeah. Also another question is, which people agree? Are there categories of people that tend to agree?
Yeah, and so I mean, I did also I meant to mention, so in addition to the ratings, I do have open responses, right? So that I do see, like, some people mentioned specifically that they work for companies that do forensic, that work in forensics, and they are very interested in those kinds of interaction, collaborations with police, et cetera. And that's something, so that those are, I do have the data on, the kinds of companies that people work for. So and that's not the only, there are other features, age, geography, et cetera, that I also have, that I'm still working through analysis on.
So I want to give other people a chance too. Other comments for Alexis?
Alexis, thank you so much. I might have missed it, but is there a reason why you decided not to ask your participant at the first round of the Delphi to just share their issues written and to utilize your interviews instead?
So I think it could have been done. Could have been done potentially through a Delphi round. I think that the kind of level of discussion that for me it required to be able to fully understand what are the concerns, I wanted a little more than a written round. I guess we could have done it. I mean, I could have framed it more firmly as just one of the Delphi rounds, but I mean, I think it could have been designed that way as well. But for me, it made sense to dig a little bit deeper through an initial sort of exploratory round before structuring and planning the Delphi.
Just following Ruth's question, do you have questions asking some basic demographics or things like that about your participants when they answer?
Yeah. So I actually have it set up as officially they're in order for it to be it's an anonymized survey. So they essentially, once they complete the first, they're sent to an additional survey where they are asked for demographic information, but it's not always, so it's basically, yeah. In any case, yes, I think I don't want to go too much into that, but yes, I have demographics and company
not
type
linked to the answer, so you cannot tell.
Exactly.
Minorities tend to be more worried about police than none, or things like that. You cannot get to these.
Oh. Mm-hmm.
Yeah, and because it's a sort of a sensitive arena, I struggled a bit, but to run it as an anonymized, because the thing is the kind of demographic information that I wanted to be able to collect, also to at least understand the sample, would have been potentially identifying.
The comments, questions?
I know we're past the 4 o'clock hour.
Yeah, but we have people that are still very interested, I'm sure. Some people are telling me in the chat that they had to leave, but.
Yeah, that's okay.
Yeah. Well, if there are no more questions, I just want to thank you so much. I mean, I think this has really been a fabulous session, and I'm really glad that all of you could attend. And especially we should thank our speakers, Jesse Burke, Sarah Bauman, of course, Vanessa Hiratsuka, Daphne had to leave as well, and Alexis, thank you so much. I've really learned a tremendous amount from this. And I'm sure others have as well. So take care, everyone. Have a good weekend.
Bye, folks.
Bye.